Hello, welcome to your lecture for Chapter 9 on Articulations. Our skeleton protects vital organs and supports soft tissues. Its marrow cavity is the source of new blood cells. When it interacts with the muscular system, the skeleton helps the body move. Although bones are slightly flexible, they are too rigid to bend, so they meet at joints, which anatomists call articulations. In this chapter, we examine how bones articulate and may allow some freedom of movement, depending on the shapes and supporting structures of the various joints. In this picture, you're seeing a person with rheumatoid arthritis. This is an autoimmune disorder, and the joints are attacked by the autoimmune system, or by the immune system, I should say. This leads to scar tissue in the joints, and bones end up fusing together in a process called ankylosis, and this immobilizes the joint. Let's continue on and learn about the different types of joints and the mobility that they allow. We will begin by defining what an articulation is, and then I'll tell you about the different ways to classify joints through either structural or functional classifications, and oftentimes we combine the two. Structural classification involves the kind of material that the joint is made of. Fibrous, cartilaginous, and synovial joints are types of ways to classify a joint based on the structure, meaning the material present. There's another way to define or classify joints, and that's its functional way, and that means the kind of movement that it allows. Does it allow a lot or none at all? Then we will move on and consider a few specialized joints, and then I'll tell you about the pathology of some joints, which I already showed you in the first slide. Rheumatoid arthritis is one type of joint pathology. A joint, or articulation, is the place of contact between bones, between bone and cartilage, or between bones and teeth. Bones are said to articulate with each other at a joint. The scientific study of joints is called arthrology, where arthron means joint and logos means study. The motion permitted at a joint ranges from no movement, for example where some skull bones interlock at a suture, to extensive movement, for example at the shoulder where the arm connects to the scapula. The structure of each joint determines its mobility and its stability. There is an inverse relationship between mobility and stability in articulations. The more mobile a joint is, the less stable it is, and the more stable a joint is, the less mobile it is. Joints may be classified functionally based on the extent of movement they permit. A synarthrosis is an immobile joint. An amphiarthrosis is a slightly mobile joint. A diarthrosis is a freely mobile joint. The plural terms for these are synarthroses, amphiarthroses, and diarthroses. Joints can also be categorized structurally on the basis of the type of connective tissue that binds the articulating surfaces of the bones and whether a space occurs between the articulating bones. A fibrous joint occurs where bones are held together by dense, regular, fibrous connective tissue. A cartilaginous joint occurs where bones are joined by cartilage. A synovial joint has a fluid-filled joint cavity that separates the cartilage-covered articulating surfaces of the bones. The articulating surfaces are enclosed within a capsule, and the bones are also joined by various ligaments. Articulating bones are joined by dense, regular connective tissue in fibrous joints. Most fibrous joints are immobile or only slightly mobile. Fibrous joints have no joint cavity, the space between the articulating bones. The three types of fibrous joints are gomphoses, sutures, and syndesmoses. Again, these joints are immobile, which means synarthrotic, or only slightly mobile, which means amphiarthrotic. Sutures are immobile fibrous joints, or synarthroses, that occur only between certain bones of the skull. Sutures have distinct, interlocking, usually irregular edges that both increase their strength and decrease the number of fractures at these articulations. In addition to joining bones, sutures permit the skull to grow as the brain increases in size during childhood. In an older adult, the dense regular connective tissue in the suture becomes ossified, fusing the skull bones together. When the bones have completely fused across the suture line, these obliterated sutures become Synestoses. Syndesmoses are fibrous joints in which articulating bones are joined by long strands of dense regular connective tissue only. Because syndesmoses allow for slight mobility, they are classified as amphiarthroses. Syndesmoses occur between the radius and ulna and between the tibia and fibula. The shafts of the two articulating bones are bound side by side by a broad ligamentous sheet called an interosseous membrane, or interosseous ligament. The interosseous membrane provides a pivot point where the radius and ulna, or the tibia and fibula, can move against one another. A gomphosis, or gomphoses for plural, resembles a peg in a socket. The only gomphoses in the human body are the articulations of the roots of individual teeth with the sockets of the mandible and the maxillae. A tooth is held firmly in place by a fibrous periodontal membrane. This joint is functionally classified as a synarthrosis. However, let's consider an orthodontist's job. The orthodontist's job is to reposition these normally immobile joints through the use of bands, rings, and braces. In response to these mechanical stressors, osteoblasts and osteoclasts, which we learned about in Chapter 6, work together to modify the alveolus, resulting in the remodeling of the joint and the very slow repositioning of the teeth. The articulating bones in cartilaginous joints are attached to each other by cartilage. These joints lack a joint cavity. The two types of cartilaginous joints are Synchondroses and Symphyses. Again, I want to reiterate that joints can be classified with respect to structure and function. And as I said before, we oftentimes combine these words. Right now we're focusing on the structural classification, which means what components make up the joint. We can also add words to describe their functional classification, which means how movable they are. Cartilaginous joints, like I just said, are joints where bones are united by cartilage. They lack a joint cavity. But we can also further classify them based on their functionality or mobility. Cartilaginous joints can be synarthrotic or amphiarthrotic. Let's learn more about cartilaginous joints. The two types again are Synchondroses and Symphyses. An articulation in which bones are joined by hyaline cartilage is called a synchondrosis. Functionally, all synchondroses are immobile and thus are functionally classified as synarthroses. The hyaline cartilage of epiphyseal plates in children forms synchondroses that bind the epiphyses and the diaphysis of long bones. Remember, the epiphyses are the ends of bones and the diaphysis is basically the shaft. When the hyaline cartilage stops growing, bone replaces the cartilage and a synchondrosis no longer exists. Another synchondrosis is the attachment of the first rib to the sternum by costal cartilage, called the first sternocostal joint. Here, the first rib and its costal cartilage, formed from hyaline cartilage, are united firmly to the manubrium of the sternum to provide stability to the rib cage. A final example of Synchondroses are the costochondral joints. These are the joints between each bony rib and its respective costal cartilage. The costochondral joints are different from the articulation between the sternum and the costal cartilage of ribs 2 through 7, which is a synovial joint, not a synchondroses. A symphysis has a pad of fibrocartilage between the articulating bones. The fibrocartilage resists compression and tension stresses and acts as a resilient shock absorber. All symphyses are amphiarthroses, meaning that they allow slight mobility. One example of a symphysis is the pubic symphysis, which is located between the right and left pubic bones. In pregnant females, the pubic symphysis becomes more mobile to allow the pelvis to change shape slightly as the fetus passes through the birth canal. Other examples of symphyses are the intervertebral joints, where the bodies of adjacent vertebrae are both separated and united by intervertebral discs. These intervertebral discs allow only slight movements between the adjacent vertebrae. However, the collective movements of all the intervertebral discs afford the spine considerable flexibility. The hyaline cartilage of epiphyseal plates in children forms synchondroses that bind the epiphyses and the diaphysis of long bones. The hyaline cartilage of epiphyseal plates in children forms synchondroses that bind the epiphyses and the diaphysis of long bones.